Introducing Cynefin LifeJinni, your health buddy.
Hi, my name is Dr. Roopa. I run this Wellbeing clinic in Bangalore. It's basically an integrated and functional medicine clinic. Here, doctors from various medical systems work together functionally, and we have many programs which helps in preventing or reversal of disorders, especially the lifestyle disorders like diabetes, thyroid, hypertension, any cardiovascular disorders, skin disorders, autoimmune disorders. And we've seen excellent result by integrating various systems of medicine. So here we do allopath, ayurveda, naturopath, yoga, we do therapies. So basically a complete package for a complete program for health and wellness. In fact, Medica, I saw this to be very useful for many people who are in the pre-diabetic or people who've been, we tried this Medica product on some of the diabetic people and also people with fever and cold. During this COVID, it was helpful too for them. There we see a drastic change in their reading, especially FBS and PPBS. FBS and PPBS anyway on a day-to-day basis it keeps changing based on the food what they take. But when we have done this, systematically we tried on people for a month or two. In some of the cases it completely came down, especially people who were not on medication yet. And when they tried this, we were able to stabilize them and bring back to normal, and then put them back on on diet and helping them to maintain. In some of the cases where in fact we do a diabetic reversal program here. It's a 1 month or a three month program where we put them back on lifestyle. There are a lot of lifestyle modifications. We put them on yoga, corrections in their diet, and this is a very natural way of reversing diabetes and bringing back discipline into their life. But there are a lot of people who are not able to get into this discipline for various things. Somebody is very busy and they can't come, they probably can't do their daily exercise, they can't join yoga sessions under the guidance, and there are many people who have medical challenges who can't really bend their body. So in these restricted cases, or people who are not able to put themselves back on discipline, I think Medica will definitely help, because on a daily basis, if they are able to sit down for an hour or so, what we have seen. In fact, there was one patient who came here with high sugar, and he was on medication for almost 9 years plus. And what we did was, in this case, we put him on Medica even before we put them into a program, so that his dosage of medicine would not increase by the doctor when he would see him first. So we put him on Medica, reduced the sugar level a bit, and then put him into a program. There's one patient, Krishnappa, who came with almost nearing to 300 sugar. He was diabetic for quite some time, and he was fed up because every time he would go to the doctor, obviously the dosage would increase, it would not come under control. Not that he had a bad discipline of his lifestyle. When he came here, what we did was we put him on this. His HbA1c was 10.5. Before we put him into the program, we wanted to check if we can reduce his sugar to some extent. So there was a drastic change. 45 days on Medica, his HbA1c came down to 8.2, and then we continued the program with his lifestyle change. The only thing which we had done along with Medica was there was a slight, small difference in his diet, and there was a huge reduction in HbA1c as well as FBS. In fact, when he started on Medica, his PPBS was 235. When we took him out, his PP was continuously about 160. So, in fact, we would want to use this to more number of patients here within the clinic who cannot afford to take up our entire program, or people who cannot really stick to the lifestyle modification program. That would be wonderful. Within clinic, we would want to use it like that. And people who can afford to buy the machine, I think that's the best thing that can happen. So in various ways, I felt eMedica as a wellness device is very good for those who cannot put themselves into routine, for those who cannot follow a good diet program, people who are traveling a lot, can't stick to a certain discipline. So I, in fact, have been telling my doctors, people who are not listening to you, maybe they are the people who eMedica is best. And yeah, I think in a house where there are more than one person with one or the other lifestyle program, eMedica would be the best solution. So every house having one eMedica, I think, will solve a lot of problem, be it simple fever and cough, respiratory issues, or diabetes. So yeah, I think each family should have an eMedica device at the house.